Our top stories tonight on The World. The federal government will shoulder some of the financial stress on the aviation industry, pouring $165 million into helping Qantas and Virgin continue flying domestic routes. A curfew will be introduced in Papua New Guinea's capital, Port Moresby, after the city recorded its first few cases of coronavirus. And the Japanese government is extending the state of emergency to the entire nation to prevent the further spread of the virus. Well, Prime Minister Scott Morrison has defended his decision to keep nationwide restrictions in place. Speaking to 7:30's Lee Sales earlier, he outlined the repercussions if the lockdown is lifted too soon. He also reiterated the importance of getting the balance right between the economy and the health of the nation when dealing with the pandemic.
And that is, we've got to fight this war on two fronts. You can win the health war and lose the economic war, but you've got to deal with both of them at the same time. And that's what we're doing. We will move these restrictions when we can get the health protections in place, because this is what happens if you don't. If we don't get those three things in place, because I've heard this theory, I'll just go and let it go now, and if it gets worse, we'll do it all again. Well, I'll tell you what happens then. The outbreak gets so severe, and if you want to know what it looks like, go and look at New York, go and look at London, go and look at Spain, all of those places. That could be Australia. We should not kid ourselves that the success we've had at the moment protects us from ending up where they are right now. If you don't keep it under control, it'll get away from you quickly, and then you'll have to lock down even harder, and the economic costs will be even worse.
And Australia's jobs market has hit a wall. Around 3,500 people lost their job in March, bringing total unemployment to 5.2%. Now, that's an increase of just 0.1% on the previous month. Experts warn these numbers don't paint the full picture. And work opportunities are evaporating, with job ads plummeting as the economy goes into hibernation. Here's Philip Lasker.
This limited edition Harley-Davidson is for sale. Its owner, Jason Leitner, has been made redundant for the first time in his working life.
Everyone was packing up their computers to head home for that day. I got my desk half packed up and was pulled into an office and told I was made redundant.
Jason will join the ranks of the unemployed yet to show up in the latest numbers, and there are people on the JobKeeper allowance not working but not considered unemployed.
I'm going to be looking very closely not just at those headline numbers that we get, that we use as benchmarks, but also as these other measures that are going to give us a clearer idea of this shadow unemployment, if you like.
Today's unemployment numbers reflect the first 2 weeks of March before the COVID crackdown. Just days after the official unemployment survey cut off, searches for the word Centrelink surged tenfold as jobs evaporated.
We've seen job advertisements fall in pretty much every sector of the economy.
After the typical ramp-up in job ads for the new year, the bushfires struck, and it was the distancing measures which saw job ads collapse nearly 65% in the last week of March.
We had job ads for hospitality and tourism down by about 84% compared to the same time last year.
These are not encouraging signs for Jason Leitner, but the resume is ready to go.
I'm hopeful. I'm just not going to get the dream job. I'll take what I can.
Plenty of time to prepare that bike for sale. Philip Lasker, ABC News.
Well, a high-profile North Korean defector has made history by becoming the first to win a seat in South Korea's parliamentary elections. Tae Yong-ho was elected as a lawmaker in the affluent neighbourhood of Gangnam, winning almost 60% of the vote. Formerly the North Korean ambassador to the UK, Mr Tae garnered international attention when he fled the North's regime and resettled in the South with his family in 2016. He says he hopes his campaign sends a message to Pyongyang to pave a new way for their future. Well, Russian authorities investigating a plane crash near Moscow have released dramatic video of the accident. The plane was struck by lightning and made an emergency landing before its rear section was engulfed by flames. 41 people were killed in the accident in May last year. The pilot has been charged with negligence, but he says the Russian-made plane has had safety problems and that he has been made a scapegoat. Remarkable vision. Well, a former lawyer for the World Health Organization has conceded China likely concealed information about the coronavirus. As we've been reporting, the US has frozen funding for the agency pending a review of the WHO's warnings about the coronavirus and China. Former WHO legal counsel Gianluca Berci says the criticisms are not entirely wrong, but now is not the time to be cutting off funding.
I mean, the criticism about WHO having been too China-friendly in January have come from several quarters. By now, even though it's a bit anecdotal, but it seems confirmed that China suppressed and obfuscated and concealed for a good month and a half. So I think that's a fact. The Chinese will always deny it, and they're able to control the narrative, so they're trying to erase history. But there's enough evidence. But when they decided to cooperate, what was the point in Tedros to say, yes, you're cooperating now, but we heard you concealed before, so shame on you, shame on you. What would we have gained? I think nothing. We would have actually forced China to posture and maybe to be less cooperative.
Well, the G20 has agreed to suspend debt payments owed to them by some of the world's poorest countries. The agreement covers money that is due to be paid by the end of 2020. The aim is to help countries deal with the health and economic impacts of the pandemic.
Ministers and governors endorsed a G20 action plan in response to the COVID-19 pandemic. The plan sets out our commitment to specific actions to drive forward international economic cooperation as we navigate this crisis and look ahead.
Well, the global battle against COVID-19, of course, raises questions over how to best manage limited resources to save as many lives as possible. Governments are grappling with how to ease restrictions and keep their economies going while also trying to limit the human cost of the pandemic. Well, let's get some insight into how authorities are managing these ethical decisions. I'm joined by bioethicist and director of the Oxford Uehiro Centre for Practical Ethics, Julian Savulescu. Julian, lovely to talk to you. Thanks for your time.
My pleasure.
I imagine the management of this pandemic has raised a minefield of ethical dilemmas. What is the biggest one in your mind up to this point?
Well, I guess the biggest issue is the value of life. Are we going to value all lives equally? The average age of death of corona is 78. So equality says we should treat everyone's life equally, no matter how old they are, whether they have dementia, whatever their chances of surviving. But when it comes to reality, many people believe we should prioritise patients who have a high chance of surviving, who don't have significant cognitive impairments or are going to live for longer, so prioritising the young. So finally, we have to get off the fence and decide, is it going to be equality for all, or are we going to prioritise some patients?
How do doctors, with the ethical dilemmas that they face and their own, the own ethics that they operate by, how do they weigh up those decisions? Should it be up to them to decide when the health system is so overloaded in places like the US at the moment, even in the UK where you are?
Well, they basically use a criterion of saving the greatest number. So that equates to saving people who have got a higher chance of surviving, or who aren't going to stay in intensive care for long periods of time. And that's determined partly by age, partly by other diseases, and frailty. So their main criterion is just trying to save the greatest number. But of course, if somebody is a healthcare worker who's infected, or if you have a very young person, even with a poor chance of surviving, those sorts of value judgments will be behind the curtain. But ostensibly, they use criteria which are thought to be clinical that affect chance of surviving.
Let's look at the debate now going on about reopening, easing the restrictions on lockdowns, reopening the economy. The US president is very strong that is the path that he wants to take. What is the ethical responsibility to workers versus the economy?
Well, I think that's, slightly the wrong way of putting it. I think this idea of the economy or dollars versus human lives is the wrong way of thinking about it. The economy equates to human lives. So after the 2008 financial crisis, there were 10,000 extra suicides in Europe and the US. There were over 250,000 extra cancer deaths. And compare that to, at the moment, there are 130,000 corona deaths worldwide. So economic restrictions equate to the loss of human lives. And I think we should be modelling the loss of life and the suffering that are caused through the policies that we make, not just for patients infected with corona, but for all patients. And so that may give you some insight into what sorts of economic restrictions you want to continue to pursue.
And do you get the sense that governments around the world are doing that kind of modelling? Have they even factored that into the decision making?
I haven't seen a single model that tries to estimate the human impact of the economic loss. Maybe they exist, but back of the envelope calculation, even on the worst case scenarios here in the UK, where it was predicted that 500,000 people would die if nothing was done, the billions of dollars and pounds that are being spent mean that we're exceeding the threshold by at least 3 times the amount we would normally spend on saving a life. So this idea that we can tip any amount of money into this just means that other people are going to suffer downstream. It's more likely that the cost inefficiency is even greater than 3 times. Some estimates put it 200 times the amount we would normally spend to save 1 year of life.
Yeah, which is a difficult decision to make in the moment when we see the numbers of deaths, here and now versus projecting down the line.
Yeah, of course, we're motivated by avoiding losses now and trying to defer losses into the future. So the human reaction to this is to try to save as many lives as possible now. But I personally think we should be thinking not just about the lives that are affected by corona, but all lives, and not just lives now, but lives over time. And it may be we're on the right course, but it may be when we start to take those calculations into account, it won't just be the economy we're thinking about all people's lives.
What about countries that have not been open and honest with their people about their capacity to manage the pandemic? Do you see that as an ethical dilemma for them, or just one that they are doing the best they can in the circumstances?
Well, I think that honesty and transparency and data are kind of democratic rights. We all have a right to know what's going on. We have a right to know how many people are dying, what our governments can do. And unfortunately, another human tendency is wishful thinking, to just think we can, have a happy ending. There won't be a happy ending, and we need to be honest with people about what we can do and what we can't do. We need to know who is dying and what our real risks are.
For example, in Australia, people who were being tested early had to meet 2 fairly restricted criteria. That was because we didn't have the testing. So, is it that we manage our resources and contain the information around that at the time?
Yeah, I think that there's a lack of willingness to say that we don't have enough testing kits at this point. We can't save every life. We can't test every person, and until we get to first base and actually know what the situation is, we can't really make effective decisions. Now, the reality is that every single resource and every day, even before corona, decisions were made about who lives and who dies, how to use the resources. But those were hidden from people, and what corona's doing is bringing those decisions right to the surface. And the first place to start is with an honest discussion about how we're going to use the limited resources, the ventilators, the hospital beds, the money, and who we're going to save with that.
Interesting point you make. Julian, thanks for your time. Appreciate it.